More than half of Americans die in a hospital, a quarter in an intensive care unit. All too often, families find themselves having to make end-of-life decisions for a loved one who can no longer speak for themselves, and they have never discussed what kind of care their loved one would want.
The final 2 strokes he had really knocked him out. He really was not conscious anymore. And for Dad, that was probably a very merciful death. He wasn't aware of what was happening to him at all.
But Liz was painfully aware of what was happening and had to decide what to do next for her father.
You can be very hard on yourself at that moment. You can feel like you're letting your parent or your spouse or your child down. I wish that I had had many conversations with my father about this. It would have alleviated so much stress and tension, but we didn't have those conversations. You have a medical condition that's happening here, which is already stressful enough, so then you add all of these other factors in. You have family members who disagree about the care that should be given and what should be happening right now. Your family needs to know the pathway that has been laid out. Otherwise, it's just chaos.
One way to avoid the chaos is to face end-of-life decisions ahead of time. Dr. Mahana Karlikar sees preparing patients for end-of-life decisions as part of her job.
I met you on Friday.
Yeah.
When you come into the hospital and you have either a near-death experience or something has suddenly changed, you have a new diagnosis, but I think it's a great place to start to have a conversation that ideally should be continued.
My cousin was sitting right there. Her dad had a stroke. He had to lay in that bed. He couldn't talk, really. And then there was tears would come in his eyes. I never want to be like that.
Okay.
Along with having a conversation, Dr. Karlikar encourages patients to fill out Tennessee's Advanced Care Plan, which is a legal document acknowledging a person's end-of-life decisions so they can be shared and followed.
So let me show you this form. Tennessee has a advanced care plan, which is a living will that goes through qualities of life, which is a really nice document. The top part lets you name someone to make decisions if you couldn't.
My oldest daughter.
So you would put here her name.
A lot of people misunderstand that they're really signing away their autonomy. If I fill out one of these forms and I make my daughter my durable power of attorney or my healthcare proxy, then she now calls all the shots about my healthcare or even other aspects of my life. That's not the case. If I'm the patient and I'm awake and alert, then it's my call. I get to be the main player and actor in that conversation and those decisions.
After a healthcare agent has been identified, the next 2 sections of Tennessee's Advanced Care Plan go through scenarios addressing what you would consider an acceptable quality of life, and what treatments you would want if that quality of life can no longer be achieved.
If that was going to be a permanent thing, I don't want that.
As a social worker for a live hospice, I'm very familiar with the Advanced Care Plan form.
Hi Jared, how are you today?
We deal with these every day, and we offer them as a service to our patients to assist them with filling them out, not only to our patients, but to our family members if that's what they want.
Once the Advanced Care Plan is filled out, the document needs to be signed.
That form needs to be either notarized or it can be witnessed by 2 witnesses. They should not necessarily be family members. They can just be a neighbor. They are witnessing the fact that you know what you're signing and that it's your signature.
So I can choose yes or no on each of these.
When we have a patient who has their advanced care plan completed, then the family can just be a family. They don't have to be a decision maker.
I'll come back tomorrow and we'll look at that. When you have advanced care directives, whether they are written or you have a robust conversation and that information is communicated to the family and ideally the doctors, they're actually very effective. I think the most important thing, if you're someone at home trying to do this and think about, well, how do I make sure what I want happens, is sit your family down and have a conversation. And they will probably not want to have the conversation, and what you need to tell them is, listen, I know you don't want to hear about this. I know you'd rather do anything but this is really important and I just need to tell you this. And once I do, we're done. And in most situations, that works.
Looking at what my father went through. One good thing that has come out of all of this is my husband and I sat down with our son and we told him point by point by point how we wanted all of this done, and we have filled out the documents. My son will not be faced with these kinds of burdens when I go.
For more information about starting a conversation with your family and to access Tennessee's Advanced Care Plan, log on to thegiftinitiative.org. The GIFT Initiative is a community education collaborative in Tennessee led by Alive Hospice.